I'm Jane Padmore and I'm the Chief Nursing Officer at Sussex Partnership NHS Foundation Trust. And I am a registered mental nurse, but I started my career as a healthcare support worker with people who have a learning disability, and then for people with a mental health problem before I did my registered nurse training. I think having been a healthcare support worker, although I have to admit it was many years ago, and when I was thinking about this I realised it was 3 decades ago, so that's really shocking, but it has ensured that I always remember the value of healthcare support worker and the unique perspective they bring. So I think there's something for me around fresh eyes and often seeing solutions that are innovative and different. I also really enjoy the fact that support workers are often from the local community, and that fits really well with our trust vision to improve the quality of life for the communities we serve. Healthcare support workers are often people that are really embedded in their local community and come with a different perspective. I think they're a great workforce that should be celebrated every day. So as part of my job, I visit services all the time. I'm in and out of wards and community services and visit, and although I'm not providing direct clinical care, I spend time talking to support workers and registered nurses and people from other professional groups. I really enjoy speaking to the healthcare support workers and finding out how they feel things are on the ward, what things could be done to make things better, and the innovative ideas that they come up with. I also really enjoy the relationship that I often see between them and patients. So the chat and the being alongside somebody and supporting someone and really getting to know them and spending time with them. I also find that support workers are people who will be very honest about how things are, and will tell you exactly what it feels like to work on a ward or to work in a service. And for me, that's really valuable, because I think it's important, if we're going to really ensure that our services are safe, effective and a really good experience, we need to listen to the whispers in the wind before they become storms. And I think often the healthcare support workers are aware of the whispers in the wind that before they come through on an incident form or through formal means. So they offer me a really valuable insight into how things are in services. I think in SPFT you will be welcomed into the SPFT family and contribute in a unique way, working in partnership with patients to help them to recover. I think there'll be opportunities to grow and develop, whether you want to remain as a support worker and really develop within that role, or if you want to train to be a registered nursing associate or a registered nurse. SPFT will invest in you and will invest in your development and will invest in your career journey, and we do that by getting to know you personally, what things are exciting, what things make you excited, what things you're passionate about. And I'd also say that one of the benefits of SPFT, it's a very large trust, and if you don't find your home as soon as you come into the trust, so you're in one service and you think this really isn't for me, then there are plenty of other services that we could move you to. So it's about trying it and seeing. I know for me, I started off in learning disability and I really, really enjoyed that. I've worked in CAMS. I really enjoyed that. I touched on older adult services. That wasn't so much for me, and that's fine. Everybody will have their own thing that they're interested in, and it's important we find your home in SPFT and the thing that you're passionate about, because then you will deliver the best care and achieve the best outcomes for our patients. As a healthcare support worker in SPFT, you get a whole range of benefits and support. You get the usual employee benefits, things like one that my family and my children particularly like is the 10% discount in Nando's, but you also get psychological support through supervision. You get investment in your your continuous professional development. You get appraisals so that we can really see where you're succeeding and where you want to develop further. And you will be thought about as an individual person with individual development needs, and that will be tailored to you. SPFT is a fantastic organisation to work in because it's made up of fantastic people. And when you come and join us, you'll be joining a great family of staff and patients that are wanting to deliver high quality care. You'll be joining a trust that invests in you and really cares about you. And I look forward to meeting you as I travel around the trust.